Hi, I'm Michelle.
I'm Joe.
We're here with Vet Medics, and today we have a special guest with us, Dr. Lisa Walling of Comfort & Care Veterinary Services. We work in conjunction with some services that we provide, including in-home euthanasia, hospice, palliative care, and she also provides acupuncture services.
So I work with Vet Medics on a regular basis, and we kind of work as a team to go to homes to help people out at the end of life for their pets, either for hospice or palliative care. So as long as I set up a client relationship and meet your pet, then Michelle can go in and help out with doing some technician services at the home, being giving sub-Q fluids, helping with treatments, helping keep your pet comfortable at home, and then getting back to me with what's going on and how the pet is doing, especially if I can't get to a pet. She can come and evaluate your pet until I get there. And hospice care, I guess I'll explain hospice care. Hospice care is generally kind of guidance toward the end of life, helping people once their pet has either a terminal illness or a very chronic illness that is not going to get better and just going to kind of progress. I can help by coming to your home, evaluating your pet in your home, which gives us a lot more information than you can get being in the hospital. So I can see the environment, where you have your food dishes, what your floors are like. All those things can kind of help you keep your pet most comfortable at home, as well as prescribing medications. And then offering also acupuncture can be very helpful for pain, especially with arthritis and back pain and neurologic issues. Acupuncture is excellent for that.
That's why hospice, I think, is so important to offer, and it's an awesome service. I mean, we get a lot of calls, and automatically people ask, you know, is it time for euthanasia? And I don't think a lot of people know that veterinary hospice care exists. So it's an awesome service that she provides, and yeah, we work great in conjunction with one another. And yeah, we help prolong the life of a lot of pets.
Yeah, and we can kind of guide people toward the end of life if they're not quite sure if it's time. We can give them a lot of information to help them figure out when it is time, and I can help them make that decision when it is the time to finally euthanize. So there's things like pain charts, so we know so pet parents can kind of look and see certain positionings and certain behaviors that they're doing at home to know if their pet is in pain. And monitoring respiratory rates. I can give them all kinds of things that they can do at home to know if their pet is getting worse, which can really help the owners know if their pet is worsening, if their pet is suffering. And then once they make the final decision, then we can also help them at that point with the euthanasia in the home.
Right.
Yeah.
And that's another reason why we work in conjunction with Dr. Walling. Again, we get a lot of calls for euthanasia, or how do we know when it's time to euthanize our pet. And being a licensed tech, which is awesome, but very limited as what we can do medically. So that's why, you know, we need a doctor such as yourself, who is awesome and offers all these great services that, again, I don't think a lot of pet parents know.
Yeah,
you know, they don't know that these
options
exist, you know, to certain medications and changing certain things in the home. And
and also just coming to see one of us, it doesn't necessarily mean that you have to cut off communication with your regular veterinarian. What's great about hospice care is it's this whole team effort. So the team includes me as the hospice veterinarian, your regular veterinarian, possibly your oncologist, Michelle as a vet tech coming to your house to help, and then we can even get people, we can even help with social workers if you're having a lot of trouble.
That's where Joe comes in.
right. So we can.
It's helpful.
Yeah, it's a whole kind of holistic approach to helping the client. And in hospice care, my patient is basically considered the owner and the pet. So I help the owner, not just the pet. So that's part of it, is kind of helping people and guiding them through this, to watch for things that their pet maybe is ready for euthanasia, and, things that I think are most common to watch for are
Right.
decreased appetite. A big one is decreased socialization, that your dog is normally sitting on the couch with you when you're watching TV, and now they're off in the kitchen where they never are alone. They don't want to go outside. They're having more trouble getting up. They're falling frequently. Those are all kinds of things, and we can kind of help them. And you can also do a quality of life assessment, which is just kind of going into the home and checking and helping people figure out if their dog's quality of life is good enough to,
Right.
keep going and keeping them medicated, or if it is maybe time for euthanasia.
Right. And Joe actually talks to quite a few clients too, when we're in an emergency type situation or even at the hospital and owners are really still having a hard time whether to decide if this is it or not. They kind of look to us because we've already made that connection with the owner and the pet at their home going into the hospital, and then they kind of look to us as if to still help or give answers or just to be there.
Because I think,
support.
it's always a hard decision, and it's never a decision that we can make for the owners or pet parents, but we can listen to what's going on and help them to really look at some of the things that we know are significant factors.
Right.
And it's, I think it's always helpful just that, as you said, it's a team approach, and that the owners and parents are part of the team too.
Yeah.
And when everyone works together, it makes even a hard
Sure.
situation a little bit easier.
Yeah.
Yeah. So, with the hospice, we kind of went into all the things that you can offer and stuff. But again, we get phone calls. How do we know it's time? I think we have to euthanize our pet.
Yeah. I usually, can figure out usually pretty well on the phone by talking to them about like I said, like appetite, activity levels, socialization,
Right.
Breathing, if they're having trouble breathing or coughing or bleeding, or, if they already have a previous diagnosis from their veterinarian that we know is a terminal diagnosis like cancer, then we can kind of tell by some of the things they tell us on the phone if it sounds like it's time. And then the nice thing is once we go to the home for the euthanasia, if they set it up, if we get there, which Michelle knows, if we get there and it seems that, there's still some more that we can do to keep their pet comfortable a little bit longer, if that's something that they're interested in doing, then we can turn it into a hospice evaluation. So I think a
we've
lot of
shown up to
people-
people's houses and
yeah.
expecting to euthanize their pet, and
Yeah.
we walk away giving them an extended life.
Yeah, and they
So,
get to be
and
there.
it's-
And even
and
if
it's
it's
nice.
only a week longer, I think it's nice to have your pet there, as long as they know that someone has come to evaluate their pet and
they're so
tells them
appreciative
your
of it
your
at the
pet's
end.
not suffering, and there's more that we can do. So that is a nice thing to be able to offer.
Yep. I mean, what's your feeling on, we always say nobody wants to play God, and,
Yeah.
we just recently had a case not too long ago where the owners were definitely in stress with the bigger dog, and, she kind of looked to you for some guidance as to,
Yeah, and again,
what do you say? What do you...
right, that
what do you
it's
offer?
never right to make a decision for people. Can help them to look at what's going on. It can
Right.
tell them what I'm seeing with the dog. The dog appears to be in distress, and what the options are.
Right.
Which I think a lot of people aren't aware of the hospice care as an option.
Yeah.
So that's this other piece of it. But I know at this recent case that I worked with, the option at the time was either to euthanize the dog or for us to transport the dog to a specialty center. I said, we can certainly do that. What I let them know is there were no guarantees with that,
Right.
that it would be stressful for the dog, that we would do our best with the dog, but it was just something for her to think about, that it didn't guarantee an outcome, that it was going to be an added stress, and I think that enabled her to make the decision that she didn't want to go through with that.
Right.
I think that people just need a little help
Yeah,
thinking
right.
things
And we
through.
always say, we can't make that decision for you.
No,
we
but you
can't. We're
can-
here to help and help
Right.
guide you. And,
Yeah, definitely guide people and make them feel comfortable with whatever decision they
Right.
make one way or the other. Another thing that people probably don't know about hospice care is that once in a while we have people that, due to like religious or ethical reasons, they don't want to
That's
euthanize
another-
at all.
Yeah.
So a lot of veterinarians at your hospital, if you're in your hospital, there's nothing you can do. You kind of
Right.
have to know that pet is going home to potentially suffer until it does pass away. And with hospice care, I can come into the home and actually help guide people through what's called a natural death. So it's not that common, but if like especially for religious reasons, if someone doesn't believe in euthanasia,
Right.
I can help keep them medicated with pain, and that's something that sometimes we may need to stop in daily. I might have to have Michelle stop in every day, or myself, to check on that pet and make sure that they're not suffering, and that we keep
have a
them
client like
medicated.
that,
for
you
Yeah,
know,
we've had
that
a
we've
couple. We
gone
have a
to-
couple like that.
Yeah,
and
plenty of times.
bandage
and-
changes and whatever
Yeah.
is necessary. But that's why it's great to have, that like with human medicine, a doctor directs the treatment, a technician or nurse
Yeah.
is able to carry some of the treatments out. I can assist with certain things,
Right.
but it's all those options. I think a lot of times, people have their reasons why they do or don't want to euthanize at a given time, and sometimes it's just validating for
Right.
them
Exactly.
what they're seeing, what they're feeling, and that yes, this is why maybe you want to keep going a while, or maybe this is why you want to move to euthanasia now.
Yeah. Yeah. And even if someone does choose to kind of try and have a natural death for their pet at home, if things really change for the worse, obviously that can change every day. They can change their mind and see
Right.
that now their pet is suffering too much and we can't keep it comfortable. And then we may say, we're recommending euthanasia for your pet. But it is an option for people to have that I think no one knows is available. They think they just have to go home from the
Right.
vet and wait for
Right.
their poor pet to die at home. And that's when your pet is definitely going to suffer if you don't have someone helping you through it.
Right.
Yeah.
So why don't you touch on acupuncture also?
Okay.
I mean, it's a practice that's been around for quite some time.
Yeah.
Eastern, Western now.
Right.
and,
Yeah. So the Chinese
right.
developed it, and I learned it from more of a scientific perspective than from the Chinese perspective. It's all the same points, and the Chinese figured it out somehow.
which is incredible.
It
to
is
me.
incredible.
It's
It's just
mind-boggling,
amazing.
and it works.
Right. So how acupuncture is actually scientifically proven to work. It's not just hoping that it works, but so it's points on the body. So I know in Chinese medicine they talk about meridians and qi flow, but I've learned it from the perspective of the points run along where nerves and vessels run, and so it stimulates those nerves. It can kind of help your fight or flight response, the sympathetic nervous system. It can kind of decrease that a little bit, and it can help with the parasympathetic nervous system, which is more calming. It can help with pain, inflammation, just because it's around all those nerves and vessels. And there's different points so basically the nerves go out of the spinal cord and they go to different organs, and that's how some of them help different organs, like the
Right.
kidneys or the liver. So we can make a difference. We can make a difference with appetite and pain and it can anxiety too. So it can really help with anxiety if you have an anxious pet. Acupuncture may be enough to
What's your most,
calm them down.
I guess, what's the word I'm looking for? What do you get called for most to do acupuncture for? What,
Yeah.
Arthritic pain,
Yeah.
kidney disease?
Yeah, most often it is arthritic, big old arthritic dogs, but actually, or neurologic. So if you have a dog that has disc disease, like if you have a ruptured disc, and then you take them to the specialty center and they recommend surgery to remove that disc material, and that can
Which
be
we see a lot of those
very
cases.
expensive. Yeah, so
We
that
see a lot of
can
them.
be like
Yeah.
$6,000 to $8,000,
Sure.
I think. And so a lot of people cannot afford to do that. So another option is either doing the surgery and then having acupuncture afterwards. But if you can't afford the surgery, it's worth trying acupuncture as long as we can keep your pet medicated for pain while we're trying to get their neurologic function back. But it can make a big difference, just acupuncture without surgery for backs. Yeah, I actually do some on. I have
She's
some cat
busy with it.
patients. Yeah, I have some cat patients too. I have a little kitty cat that has some neurologic weakness to his back legs, and we've been doing acupuncture now for a few months. He's a super chill cat. He sits on his owner's lap and just lets me put the needles in, and then
Wow.
hangs out on her lap.
That's awesome.
For 15 minutes, we just leave the needles in, and he's now like jumping up onto his cat tree. Like he's doing great. They're really happy. He's like 18 years old.
Oh my
and
God.
now he's doing
That's
really
great.
well. Yeah.
Cool.
And she notices when the acupuncture starts to wear off. So I'm going to him every couple weeks now.
Well, you performed it on one of my past dogs,
Oh, yeah.
Polly.
Polly.
Towards his end, he had some neurologic issues,
Yeah.
kidney disease, and arthritis, and definitely after,
Yeah.
you could definitely tell a
can
difference.
help. Yeah.
Yeah.
Sometimes they're really sleepy after the first treatment or after each treatment, but then it can really help.
Do you ever get good results from just primary anxiety, maybe a dog with thunderstorm phobia or separation anxiety or...
Right. I mean, it could potentially work. I haven't had a patient that has come to me for just that. Usually the patients that are coming to me are for arthritis, and they're like, oh, by the way, he has really bad anxiety. Yeah. And so it can help kind of calm them down a little bit. I haven't tried one that's just totally behavioral.
Yeah.
Yeah. But I think it could really help. There's a bunch of points that can really help calm down the sympathetic nervous system, so I think it really would make a difference. Yeah.
Yeah, Dr. Walling, I think it might be helpful for people to hear a little bit more if they're not familiar, whether or not they've been through hospice care, the actual process of euthanasia, a little bit what that looks like, especially when it's done in home.
Right, so I only do euthanasias in the home for people, and it's so much nicer at home, I gotta say, and Michelle knows this, we go together a lot, and at home, your pet can be kind of wherever they're most comfortable, on the couch, on your bed, on their bed, in the backyard. We've done it, we've kind of done it. Front yard, we've been definitely in the front yard together. And kind of anywhere that they're comfortable and you're comfortable, the whole family can be there and be around them. And we can be there kind of as long as people need. And what the procedure is, usually it's 2 injections. The first injection we give is a very heavy sedative and a pain medication and an anti-anxiety medication. So that's all in one syringe. That one they do sometimes feel and react to, but that's all
some
that
do,
they have to
don't.
feel. Yeah, some don't. If they're eating well, we usually can distract them with a treat if they still like something. So some people will make bacon for them, or I've had a family give them chocolate because they're like, they give them chocolate.
Why not? Yeah.
I always say, give them a meal fit for a king or a queen, whatever they want to eat.
They're always trying to steal chocolate, so they let them have chocolate. Ice cream, I had one eat a whole gallon of ice cream.
We had a pizza party for Remy.
Oh, that's sweet.
His favorite food. So yeah.
So you can offer them anything like that. And then the sedative takes anywhere from 5 to 15 minutes to take full effect. And how I know is I kind of touch their feet and see if they have any reaction, and if they are no longer feeling anything. Then the second injection usually goes intravenously. There's other routes that we can use as well. But that second injection is just an overdose of anesthesia. So it's not painful, it's not stressful.
I don't think a lot of people know that either, what it is.
Yeah,
they just think
some people say, oh, you're going to stop his heart. No, that's not the medication that we use. We use a medication that is an anesthetic, and it's at a high concentrate, so it goes right through the veins up to the brain, and the brain quiets as if it's under anesthesia, and then the rest of the body follows. And so it's usually quite fast. Usually before I even finish injecting it, most of them have already passed. They'll stop breathing, and then their heart will stop. And then afterwards, one thing that can be a little upsetting to people is that their eyes stay open. That's just the muscles relaxing. That's not stressful for them or anything. Their brain is gone, and they've totally passed. And then afterwards, they also can urinate or defecate. So we usually put something behind them. And then afterwards, what's so nice is once they've passed, we usually let the family be alone with their pet for a bit so they can say goodbye. And then once they're ready, we can take the pet and arrange aftercare services. So we can arrange cremation if that's what people want. And then we can get the ashes back to them.
And it's just overall, a very humane, peaceful environment. Being
so
at
nice,
home, being able to have family around if they want. I mean, we've been at homes for as little as 20 minutes, a half an hour to
a couple
2 hours or more.
Yeah, my longest one was 3 hours. I've been at someone's house for 3 hours, kind of helping them and guiding them, and being with the pet and helping them make the decision, and then the sedative taking effect, and then afterwards, if they need some time with the pet. And then we can, a couple nice things we can do for them afterwards. I can clip a little fur if they want to keep that. We can make a little paw prints that they can keep. Yeah, so we try and make it as pain-free as we can make it. And it is so much nicer at home because the pet literally has no idea what's happening. They think they're just with their family and having a special treat. And then
we had a case,
fade away.
We went to a house a few weeks back, and they were still kind of undecided. They made the decision. We came out to the home. The cat has an illness, a kidney disease, I think, if I'm not mistaken. But, the cat was having a better day. It always seems that a client calls, they make the decision, or, to come to, we're going to euthanize. And then we get a call back, we're doing better now. They call it rallying, or it can last anywhere from a day or two to a couple of weeks.
Right, yeah. And that's one thing that I think people think once they make the appointment with me that they have to keep it. But I'd much rather you cancel.
Absolutely.
You know, I'd rather you cancel and you have your pet with you a little bit longer, as long as your pet's doing well, and then call me when you're ready.
Right.
Yeah.
And it comes to the saying, and you said it to these clients, you know, letting them go on a good day. Better to wait a minute too, I forget what you said, but a minute too soon rather than,
I'd rather so I tell people I'd rather euthanize my pet a day too soon than a minute too late. Yeah, right. So like you don't want to wait until your pet is in distress at home. Exactly. And you're a veterinarian as well, as we can kind of help you decide what that point might be. Right. So hopefully we avoid that panic and calling around and trying to get someone in, you know, in the middle of the night.
Sure.
And you know, having to go into the emergency hospital when you've already had, you know, relationship with us. But it's better to do it just a little bit. Right.
And they ended up being so thankful.
They were very happy. They did it. Yeah, and he had a good last day.
Right.
And that's a good memory. So they have a good memory of his last day.
He went eating and he didn't feel anything.
And then he didn't even notice the sedative. And he peacefully passed away at home. And so now they have that memory of a good day.
Right.
And a peaceful passing.
Which is very important.
Yeah, at home.
Very important.
Yeah. And then another nice thing is people can react however they want. So, you know, I see big men like breaking down and crying over it, which they may not do in the hospital.
It's hard in the hospital.
Yeah, so I think it's good they can let out all their emotions and they can hug their pet and not feel like they're trying to hold it in. And I think they're a little more willing to do that with just one person or two people there.
But I see what a lot of hospitals do now is if they have a candle and that's lit, please be respectful that someone's saying goodbye to their pet. But at home, that's not even necessary or worry about that people notice the candle, it's in your home, and you react however you react.
Yeah, and everyone is different. And so everyone asks me, oh, is it okay to cry? I don't, I'm sorry I'm being so loud or whatever. And it's like the nicest thing is just do whatever feels best to you and feels right for you after you say goodbye.
Absolutely. Yeah. Fantastic. Well, thank you for being here today.
Yes.
Oh, you're welcome.
And so, of course, if you have any questions, Dr. Lisa Walling, Comforting Care Veterinary Services. You can say your website and
it's just www.comfortingcarevet.com.